This video is brought to you by the Arrow Project, alleviating barriers to mental health services by creating innovative partnerships, programming, and professional development in the SAW region of Virginia.
Hello, my name is Sabrina Burress. I am Executive Director and co-founding member of the Arrow Project, a mental health nonprofit collaborative that stands for Augusta Resources for Resilience, Opportunity, and Wellness. Essentially, Arrow Project is positioning itself to create new and innovative mental health services for our community members, while also providing training opportunities for para and pre-professionals in the field of human services. I suspect without sharing a ton of specific numbers with you, anyone listening would agree that our healthcare system is in a crisis. But to understand how this is affecting mental health and thus the lives that we hope to touch, I would like to share a few statistics with you. ACE's Adverse Childhood Experiences Study reported that over 17 million young people are affected by serious mental illness annually, and less than half of them are ever treated. And that's a powerful picture. But for your benefit, let's bring those numbers a little closer to home. In 2016, Augusta Health did a needs assessment that suggested 52.8% of our community members see mental health as a major problem, with the number one major factors being access and affordability of care. And then in 2018, the Community Partnership of Stanton, Augusta County, and Waynesboro, also known as CAPSAW, reported that 70.69% of households experience barriers to education, employment, and housing as a result of poor mental health of one or more of their family members. This is where we believe the important work of Arrow begins. We at Arrow are seeking to bridge the chasm between community members who are desperately seeking supports and a healthcare system that is struggling to identify and provide appropriate and comprehensive programming, as well as enough qualified individuals to provide those services. Arrow has already identified partnerships with the Stanton YMCA, the Infant and Toddler Program through the Community Services Board, and even the newly established LGBTQ Center, who on October 16th organized and facilitated the first ever Stanton Pride Festival. And of course, Arrow was there to facilitate what we called the Warm Room, a place where Pride attendees could come and spend a little time with a mental health professional. It was a space that was immediately and repeatedly affirmed as needed and appreciated among the LGBTQ members of our community. And it really was a beautiful representation of Arrow's vision in real time. Right now, our collaborative programming includes needs-specific programs within our partner organizations, employee training on important mental health issues, peer-to-peer and psychoeducation groups, as well as direct consultation and clinical supports as is appropriate for community members in need. We believe this is a great first step in decreasing mental health disparities here in our community. However, I want to be entirely clear that Arrow holds no misconceptions about our ability or inability thereof to save the world altogether. That is a goal that is far greater than our scope of practice. And yet, I am reminded of one of my favorite quotes of Desmond Tutu, which is this: "Do your little bit of good where you are. It is those little bits that overwhelm the world." And that is the space where Arrow's grand ideas become a tangible reality, where we find ways to share our little bit of good with our community members. And so we invite you to share your good with us as well. This may be in the form of program ideas or connections to specific populations in need, sharing possible community partners, or even sponsorship of Arrow's forward motion. As you plan your year-end giving, we hope that you will think of us. Your gifts can be used to support program development and program funding, allow Arrow to provide fee-free service options to community members in need, as well as, and most important, to sponsor student placement in our community programs. So regardless of how you reach out, if you are interested to learn more, we hope that you will reach out. If you have ideas that you'd like to share, we would like for you to reach out. And if you would like to become an Arrow sponsor, we encourage you to please reach out. You can connect with us on Facebook via Augusta Resources for Resilience, Opportunity, and Wellness, the Arrow Project, or at our website, www.arrow-project.org. We are so excited to see how we can collaborate to cultivate a more connected, more resilient community.